Okay, great. Can you all still see my screen? Now it's on VA end of life benefits.
Yes.
You're good.
Okay, perfect. Okay, well, I'm just going to roll into the educational presentation portion of today. I'm going to be presenting on VA end of life benefits, and I do want people to feel like they can chime in with questions. I'll try to pause at the end of the slides briefly, and you can drop questions in the chat. Also, I'm happy to stay on the meeting for a little bit after it's over today. If people want to stay on and ask more questions, feel free, but probably if you have a question, other people have the same one. So please chime in. Okay, so today in covering end of life benefits for veterans, that's going to entail talking about each of the three branches of the VA. So just for some clarity, the VA has three branches: the Veterans Health Administration, that's us here at the medical centers, me and Marty. Then there's the Veterans Benefits Administration that primarily handle the financial benefits. And then there's the National Cemetery Administration. Those are the three different branches. So I am obviously much more experienced in the health administration benefits, but I can give a quick and dirty overview of the other two. But I do not work for those branches, just as a disclaimer. Okay, so first we're going to talk about the healthcare, the health administration. Eligibility is the first thing to touch base on. A lot of you are working with veterans out there, and they may already be enrolled in VA healthcare, or they may not. So not every veteran is eligible for VA healthcare, unfortunately. There's a lot of different criteria. They have to have been discharged under anything other than dishonorable conditions. So it could be honorable or other than honorable. There are some service criteria. So if you served before 1980, you could have served 1 day, but if you served after 1980, you have to have served 2 years consecutive service. There's also some financial criteria for being eligible. And then there's a lot of exceptions to what I just said. So maybe you didn't serve the full 2 years, but you were injured during your service, then you're eligible. Maybe you're over income, but you have some injury or service connection, then you're eligible. Lots and lots of exceptions. So the bottom line, what I want to tell you as hospice agencies is when you're working with a veteran, ask them if they're enrolled. I can almost guarantee you every veteran will say yes. However, they have to have actually applied and enrolled at one of the medical centers. So it's always worth a call to me or Marty to verify if a veteran is enrolled in healthcare. And if they're not, we'll walk you through that process. And between us and hospice, we can usually, if we get hospice's help filling out the application for enrollment, Marty and I can work really closely with our health benefits people to help fast track getting veterans enrolled. So I'm going to brag and say that if I can get a hospice agency to help work with the family and send me the enrollment paperwork, I am usually able to get them enrolled within 24 to 48 business hours. I don't know what it is up at Northern Indiana, but we can be pretty
Same.
speedy. The hardest part is getting that paperwork filled out and getting it like scanned or emailed to us. So that's where hospice comes in and can be really, really helpful. Marty, feel free to chime in anytime.
The only thing I was going to ask or add to that is that if the veteran was once enrolled and at one point did, but then for whatever reason never followed up, they do disenroll as well. So like say he was enrolled 10 years ago, went for a while and then just decided not to come back and then whatever. So he may be in the system, he or she may be in the system, but then they have to kind of like re-enroll again. So that happens on occasion. So just
Yeah,
just keeping up with it, making sure that they're enrolled. If that's
that they're
that's the
actively enrolled. Yeah,
yeah.
that's a very good point. And if that's the case, there's an updated enrollment process form that's shorter and easier, and you don't need the military discharge paperwork a second time. So it is easier, but there is some paperwork. It's the VA. There's got to be paperwork, right?
Oh,
Right, Al? Um, okay, so if you have a veteran who's on hospice, reach out to us. Let's make sure they're enrolled. If they're not, at least for the Indianapolis VA, I'm going to tell you there's different ways to enroll, like online or through the benefits office, but I'm going to highlight let's go with number 3, which is I'm going to have hospice. I'm going to send you the enrollment paperwork, have you work with the family to get it done and send it back to me. And then most of you probably know my nurse navigator Champagne. Between Champagne and I will help fast track getting them enrolled. And I know for a fact that Marty does the same thing for hospice agencies and tracking down her health benefits folks. So reach out to us to help fast track getting somebody on hospice enrolled. They will need a copy of their 1010 EZ. That's the enrollment application. There's a shortened version for patients who just need to update their information. And then they'll need their military discharge paperwork. And if they need help requesting a copy of that, there's a link on here to do that as well. Bottom line, reach out to us. We'll walk you through this process. But it is a process. And some veterans think just because they're a veteran, they're enrolled in the VA medical system, and that's not true.
Hey, Liz,
Yes.
just quick question. I had sent you a message in the chat, but I'm sure this is coming up. I want to make sure I just heard correctly. So before 1980, if they were on active duty one day, so even if they were in the National Guard, if they did do active duty, they might qualify. Is that accurate?
They might, but if they were National Guard, I think they will have had to have been called up to active duty.
Okay.
National Guard is a tough one, unless they were called up for active duty like after 1980 for 2 years consecutive, which would be very rare, I think, for National Guard. Then they're probably not eligible, but we can check on every case.
Okay. Yep.
But
Thank
I
you.
will say, remember, Jackie, all of those asterisks that she kept saying, there's exceptions, there's exceptions, there's exceptions. I'm just,
Right.
you know, uh, the likelihood of them being eligible is fairly high, but at the same time, it doesn't hurt to ask. And
Right. Okay.
I mean, you just never know, because like National Guard sometimes, maybe they, had enough time where they, had, so for instance, basic training, and then they go to their AIT, and then say they went National Guard, but then they served a few times that added up to that time. So National Guard is put on points in how that all works. So I know there's a lot to that, but I'm just saying, just try, because otherwise you don't know. You just don't know until you know when they go on.
Okay.
Yeah, you'll also have some veterans say, I applied years ago and was denied. I'm not trying again. I'm not eligible. Well, maybe that was income based and their income has drastically changed. So if somebody's been denied in the past, it's still worth asking them to try to reapply. And I'll get to all the benefits, which is the reason for making sure they get enrolled.
And I want to add one more thing to what you just said, Liz. I applied a few years ago and they denied me. Okay, what did you try? Because there's two different parts to that. Sometimes they're applying for a service connection only. And if you are only applying for a service connection, say for instance, injured your arm or leg or foot or whatever it is, back, and then that's denied, that's not enrolling for healthcare. That's a totally separate thing. So they think that that's the same thing, but it is not. So
yes, and that gets back to there's 3 branches of the VA: the Veterans Health Administration, the Veterans Benefits Administration. So she's saying if you applied for a financial benefit and were denied, you might still be able to get health care, or vice versa.
Yep.
Actually, not vice versa, because if you're service connected for anything, you can come to the VA.
Yeah, that's true. Yeah.
Okay, so this is just for the Indianapolis VA. For veterans who are on hospice, these are some really useful phone numbers for hospice agencies. Veterans who are on hospice are eligible to continue to come to the VA for a lot of things. So you'll often have veterans on hospice who are still getting a lot of meds from the VA. They might be coming in for podiatry or dental clinic or whatever. They're still coming here. So these are really useful numbers for the Indianapolis VA. If you're trying to get to anyone in the hospital, the Patient Response Center is the way to start. That's our phone tree that you can get if you need to reach primary care or anybody. Start with the Patient Response Center. And then med refills. Veterans often have to call in to refill their meds, and sometimes at end of life they're forgetting how to do that, or it's getting more challenging. So if y'all are helping coordinate med refills or whatever, here's our numbers for pharmacy. Okay, here's the bulk of what I want to say about what the VA medical centers can provide to veterans. And this is for veterans who are on hospice or not, okay? first of all, if you have a veteran who's enrolled in the Veterans Health Administration and they need hospice, they will always have a payer source. The VA will pay for hospice. You should not need to take them on as a charity case or anything like that. If they're enrolled in the VA and we verify their hospice eligibility, we can do VA pay for hospice. Other services that veterans are entitled to, again, whether they're on hospice or not, are home health aid services, in-home respite. Hospice obviously provides home health aid services, but on average, that's usually a couple hours a week. I feel like what I'm seeing is usually between 1 and 3 visits a week for 1 or 2 hours. I know that hospices can increase that to up to 5 days or daily in extreme circumstances, but I don't think it's the standard practice. The VA can authorize a bunch more hours per week of home health aid. So a couple years ago, the VA got a little smarter and extended their services for home care in the attempt to help keep veterans at home because it's in their best interest. It's what veterans want, and it's also better than paying for nursing home placement. So the VA can actually, based on the veterans' level of assistance they need with their ADLs, VA can authorize anywhere from 6 to like 56 hours of home health aid services a week. Okay. So if you have a veteran who's needing more home health aid hours than a hospice can provide, which is very, very, very common, please reach out to either me or Marty, and we will see what we can do to get extra home health aid services in there. What we will do is we will work with the hospice to fill out something called a case mix, which is where you guys answer questions about what they need help with, how many hours they'd like, how many hours they have right now. We'll figure out how many hours the VA will authorize for them and how that matches up with what they're saying they need. So if you have a veteran who's new on service and they're just needing a little bit of assistance with ADLs, maybe we can set up 10 or 15 hours of home care for them on top of what you guys can do. As their needs increase, so can the hours of home care that the VA pays for. So we can redo that case mix with you all as many times as is necessary. So we will commonly set up home care and then maybe increase the hours 1 or 2 times, over their last few months of life. So please reach out if you ever think you have a veteran who might need extra home care hours. The home care hours are determined. Go ahead.
I'm sorry. I just wanted to see if I could ask a quick question about that a family asked me recently. If a patient is in assisted living and they're paying for that, can the VA provide those home health care hours?
Yes, VA cannot pay directly to the assisted living. We can't pay assisted living to provide those services, but we don't have our own home health aides. We pay like community nursing agencies to go in, and they can do that in the home or in assisted living. Great question.
Awesome. Thank you so much.
And the hours, like the VA will say based on their case mix, we can provide 30 hours a week of services. And then the families choose, do they want 30 home health aid hours, or do they want some of those to be designated as respite hours? So it's a total number of hours, and it can be hands-on home health aid care or respite for the caregiver. So they can have 30 home health aid or 30 respite, or they could do 15 and 15. They split it up based on the situation. Most of the time, home care companies don't care how the hours are labeled, home health aid or respite, but I've had it be an issue before, and we've needed to designate it, so we try to. But if you ever have a caregiver who's overwhelmed, or you're thinking they might need some in-home respite or home health aid services, please reach out to us. VA can also pay for inpatient respite at one of our contracted nursing homes. So hospice is always going to be the primary for paying for inpatient respite. I know you guys can usually do like 5 days every so often at a nursing home for respite for the caregiver. Veterans who are enrolled at the VA and have a primary care doctor assigned are also entitled to have up to 30 days a year in one of our contracted nursing homes. So we have a list. Northern Indiana has their own list of contracted nursing homes. We have one down here for Indianapolis and our surrounding areas. But basically, if a we can provide a lot more inpatient respite as well than hospice can. But we always ask hospice to go first and maximize what you guys can do since you're being paid. But for example, if there's a caregiver who is going to have surgery or needs to go on vacation and she needs respite for 2 or 3 weeks, we can have them go to a VA contracted facility. Hospice can pay for the first 5 days, and then we'll pick up the rest of that up to 30 days. It's 30 days a calendar year, so it can be used all at once or it can be broken up into small snippets. But it is a great benefit. They have to be enrolled. They have to have a VA doctor. And for Indianapolis, for basically everything I'm talking about today, for Indianapolis VA, myself and Champaign can coordinate these services for you all. We have a massive team of about 12 people here in the Indianapolis Palliative Care Department. Marty is a one-woman show. So if you have these needs for Northern Indiana patients, reach out to Marty. She is your point person, and then she will connect you probably with like a primary care team social worker to help set these things up for you guys. And I just want to clarify, when I say a contracted nursing home, that comes up in several different situations. We have about 9-10 facilities that we have contracts with. Patients who are 70% service connected or higher, meaning they're disabled from their time in the military. If they're 70% or higher, VA can pay for long-term care at one of our contracted facilities. Hospice or no hospice, no questions asked. They need nursing home placement. If they're 70% or higher, they can go there and we'll pay for it. Those same contracted facilities are the ones that we use for our inpatient respite up to 30 days a year. Those are also the same facilities that we use if we approve a VA end of life nursing home contract. So if a veteran is not 70% or higher, but they're needing nursing home placement, if the VA verifies they meet hospice eligibility, the Indianapolis VA, if we verify they meet hospice eligibility, then we can approve them for VA pay for end-of-life care with hospice at one of our contracted facilities. It's a really nice benefit, especially for veterans who need urgent care or they don't qualify for Medicaid without, spending down everything, or their spouse would have trouble surviving if they apply for Medicaid. If you ever have a question about if a patient is eligible for an end-of-life contract, reach out to us. For Indianapolis, if we're the ones who set up hospice, then they're automatically going to be approved for an end-of-life contract. However, a lot of our veterans have been set up with hospice by community partners, hospitals, doctors. So if we have never seen their clinicals, we do have to review clinicals and verify they meet hospice eligibility. And then if we do, we work with the hospice team to get them set up at one of our contracted facilities. Northern Indiana, Marty, I might have you chime in here. Northern Indiana is different because they have a palliative hospice community living center. So I don't know, Marty, do we have to try to get them into the CLC before you guys approve those end of life community contracts?
So the answer is yes to your question. But I will tell you, our beds are full about 99% of the time. So yes, they do try to do a fill within the VA first. Just, we only have 20 beds available on our hospice unit, so they stay full almost all the time. People pass away every day. We've had a rash actually lately. I think we've had, I feel like within the last month, and I'm just guessing a time frame, eight the deaths, and that's a lot. For us, as far as at once, everything, but a lot of, we got them, they died the next day, got them, died 3 days later, got them, and so the beds do come open. Don't feel like you can't come here, but also the other piece is we are in Marion, and so the Northern Indiana healthcare system covers Fort Wayne, Defiance, Ohio, Huntington. Our JWC clinic is in Mishawaka. Peru clinic is called the Hoosier Clinic. Muncie Clinic. Of course, Fort Wayne and Marion clinics. And so our area is gigantic when it comes to where all the veterans can be at. And our community nursing home team understands that, for instance, let's just say, the veteran is from South Bend, right? And there is an open bed here at the CLC. The likelihood is if they want to go to a contracted nursing home in South Bend, they're gonna approve that, just because that would be a 2.5 hour drive for the family or something of that nature. So they're willing to look at that too. It's not just like cut and dry, black and white. It has to be this way. So the push, yes, is to come to the VA first, but then at the same time, there's a give there that goes with
Okay,
that. So
great. Are there any questions specific to the nursing home contracts or respite, home health aid stuff? I'll keep plugging along. Another service that the VA offers that I mentioned briefly before is concurrent care. So veterans are allowed to continue to come to the VA and continue therapies or treatment that a VA doctor deems helpful, and that does not jeopardize their hospice eligibility. So a civilian, normally when they enroll in hospice, are told to go ahead and cancel all your other appointments and treatments and yada yada, go ahead and cancel everything. With your veterans, do not do that. They are still allowed to come here to the VA. If you have questions about, can they actually do this while on hospice, just call our office and we'll talk through it. We want our veterans to still come here for things like palliative chemo and radiation, any of our specialty services, they're welcome to come to. Veterans can still choose to come to like primary care or palliative, but usually if you explain to them that hospice is the primary, we won't be able to like do anything without talking to them. Usually they'll not do those not come to those clinics, but veterans they identify with the VA. Many of them have been coming here for years and years and years. It's like a home away from home to them. And we want them to know we are still here for them when they enroll in hospice. It's not you're on hospice and the VA is done with you. We want to communicate to them that we are still here for them. We still have a lot of things to offer them if helpful. Basically the way it was it's been said to the VA Hospice and Palliative Care National is if there's some treatment or VA service that could improve the quality of life of a veteran and or their caregiver while they're on hospice, they can have that service. So it's gray, but I think in a way that serves our veterans. So if you ever have questions, reach out to us. There are some extreme circumstances, like things you would never think of, like if a veteran goes on hospice for CHF, they can keep coming here for dialysis as long as they want to. So there's some things that seem very odd that are actually okay. So just reach out for those.
Liz,
Marty
I have a quick question.
Yeah.
Do you ever find that impacts hospice eligibility if someone kind of like, I know it's allowed on the VA side. I'm just wondering if you've ever seen it kind of potentially end up like having then that treatment, kind of expand the prognosis and then someone's not recertifying or, it's not considered kind of the hospice plan of care and not of the hospice mindset. Does that make sense?
Yes, it does. It makes perfect sense. And I'm not going to do a good job answering that because it's so confusing. But I feel like veterans, they can receive concurrent care, but they do still need to be aligned with the hospice philosophy, and
Yes.
hospice agencies have to feel comfortable that they are. So I don't mean to say that they can be pursuing all life sustaining treatments and aggressive treatments and this and that. I mean, they do, generally speaking, need to be aligned with hospice philosophies, and the goal of the treatments they're coming to get need to be to improve their quality of life or comfort.
Yes.
Most of the hospice agencies we work with really well, but there have definitely been a few agencies who concurrent care makes them very, very uncomfortable and they question the eligibility and they've been unwilling to enroll veterans. That has definitely happened. That has definitely happened. Also, if there's an issue in circumstances like that where there's a lot of concurrent care going on, we can do VA pay for hospice if that helps. Like if agencies are worried that Medicare is not going to go along with it, or they can't line it up appropriately, like we can do VA pay for hospice when necessary. It's very easy to do concurrent care when the veterans are on hospice under Medicare and coming to the VA for their services. It is very, very complicated when they're on like VA pay hospice and then they're going to like some community provider for concurrent care. We can almost never convince those community hospitals or oncology centers to like keep doing the treatment. Despite our best efforts of trying like educating hospice and the community providers, it's a lot. So I think it's possible, but it's very confusing and complicated. I told you I was not going to do a good job answering that question.
I think that's
you do a good job with
helpful.
this.
It's great. And I think it's great to help our veterans, but then it also means we're like, it's hard to explain. And we probably just, in any situation like that where you're questioning, reach out to us and we'll staff the case with you guys and figure out what we need to do to help.
So
Okay,
I was gonna say,
awesome.
Katie, here at Northern, I tried to talk to the veteran themselves at each and every case like that, just to find out where they are exactly hospice minded. Lots of times with explanation and knowing the understanding between palliative and hospice and that kind of stuff, that helps when they actually talk to somebody, sit down, go over everything with them, tell them what this means, what that means, what this equals. Because hospice, we all know hospice appropriateness and hospice ready, two total different worlds sometimes. But so yeah, for sure. Like for me, I talk with each and every veteran if I can in those certain circumstances. So it's a lot of explanation with it. Yeah.
Okay, thanks so much.
It's a great question. The VA can pay for adult daycare. We have contracted adult day centers, just like we do contracted nursing homes. VA can provide mental health support. This is a big one. It's a little different between Marion and Indianapolis, but in general, if veterans are on hospice and they're needing additional mental health support to what hospice can do, please reach out to us. We can provide supplemental mental health services in person or virtually. Dr. Lightfoot, our psychologist with the Indy Palliative Care team, has come and presented several times. He's excellent at doing virtual mental health support for veterans and caregivers at end of life. The mental health services do have to be geared towards the veteran. However, he will very often start bringing the caregiver in, and then sometimes towards the end of treatment and end of life, he's working more with the caregiver than the veteran. That's okay, but at the start, the veteran has to be agreeable. So please, we almost never get referrals for mental health for veterans on hospice, and we really, really want to change that. I will send out the list of contracted nursing, an updated list of the contracted nursing homes and adult day centers after today's meeting. Thanks, Elaine. Oh, and I just want to highlight the caregiver support program. I think I'll have them come next year and give their own full presentation, but the VA has their own caregiver support program. It has kind of two prongs. One is a general caregiver support program, which is where they're providing education to caregivers, their support groups virtually, just different self-care things. It's probably similar to what hospice can do, but it's just an added support for caregivers. In the second branch of that caregiver support program is the actual stipend program. So if veterans are 70% service connected or higher, their caregiver can actually get a stipend for caring for them. I think there's 3 different tiers. So there's different amounts the caregiver can get based on the level of need of the veteran. Don't quote me, but I think they're anywhere from like $800 a month to close to $2,000 a month, maybe. So that's a really nice options for veterans. And they do try to expedite those applications for veterans who are on hospice. It would take at least a few weeks to a month, though, I'm sure. So if you have anyone who might be interested in this program, please reach out to us as early as possible. Do I have anything
Yeah, real quick on the contracted nursing homes. Liz, so our contracted nursing home coordinators are Northern Indiana is a separate healthcare system, and the Indianapolis VA is its own separate healthcare system. So though we are one VA, it's two different healthcare systems. So our contracted nursing home coordinator does not allow that list to be published, like for the public to go out and like have it. However, I am allowed to be able to tell you what at the moment is available. So if you have a question in the Northern Indiana healthcare system area, what contracted agent or contracted nursing homes are available, just get a hold of me, because that it changes so frequently. So for instance, they're very stringent upon what contract nursing homes, they have lots of rules they have to follow. They have a lot of inspections that they go through. Certain like when state comes in and does their things, they have to keep up with that. So at any point in time, they could be on the list today, but then 2 weeks later, they're not on the list anymore. And so she doesn't like to have old lists that may have been at one point true, hanging out there. So if you need something in the Northern Indiana area, let me know, and I can let you know who is on the list at the moment.
Yeah, and I can understand that because it does change time to time for us for Indianapolis as well. So I would say it's good practice if you're thinking about asking if a patient is eligible for a VA contract, touch base with our office before you give the list to the family and start talking to them about facilities. Let's make sure they're eligible and that you have the updated list before you start making referrals. Okay. And just so you know, the Caregiver Support Program stipend program, that used to be only for veterans who were post 9/11, but it has been expanded in the last year or two to veterans of all eras. Okay. So any veteran who has a caregiver who's enrolled in VA healthcare can, their caregiver can be part of the general program. And then if they're 70% or higher, can be eligible for the stipend. Okay. I am going to switch gears. So up until now, I've been talking about the Veterans Health Administration. Now I'm moving over to that second branch called the Veterans Benefits Administration. All financial benefits go through the VBA. So if you have veterans asking about service connection or non-service connection or aid in attendance, I'll touch base on these a little bit more, but anytime a veteran's asking about a financial benefit, send them to the VBA or a representative that's trained on VBA benefits to help them figure out what they're eligible for and how to apply. So I will also send this list out. It's been sent out to you guys before, but they can go straight to the VBA office. They can go to their county service officers. And there's also a lot of really wonderful offices like with the VFW and Legion. But we will send out again this handout that you can give directly to veterans and their families with all the different locations. They can get a trained benefits expert to help them. They should never pay for assistance with applying for a VA benefit. All of these resources are free. There definitely are people out there who charge. They probably do a good job, but a veteran should not have to do that, and they should be able to go through one of these to get their benefits. I'm going to keep going for time's sake, but like I said, I'll stay on the call afterwards if people have specific questions, but still you can drop them in the chat and chime in. You will hear veterans ask about service-connected disability. This is a disability that's proven to have started or worsened during their service. It's a tax-free amount. Veterans can, they're service connected by a percentage, so anywhere from 0 to 100%. If you're service connected, you're getting free medical treatment for that condition plus a monthly income. And again, don't quote me, but this is very substantial for veterans. If you're 10% service connected, you're probably getting $150 or $200 a month, all the way up to if you're 100% service connected with like homebound status, you're probably getting between $3,000 and $4,000 a month tax free. Veterans, like I said, this is really, really important to them, and not only for themselves, but veterans are providers. They love to take care of their families. They are often using this money to take care of entire households. There are some medical conditions that are approved as presumed conditions. So there are some disabilities that if you served during this period of time in this location and now you have this health condition, you're automatically going to be approved for service connection for that. A lot of those come from like Vietnam era veterans with Agent Orange, which there are a lot of different cancer conditions, diabetes, things that are going to be automatically approved. If a veteran has started a claim and they pass away before it's seen through, the spouse can see that process through, and there would be a little back pay and then some survivor benefit eligibility. So it is worth having veterans, even if they're on hospice, applying for service connection for multiple reasons. One, the immediate financial benefit to themselves, but then also it probably increases eligibility for survivor benefits for their families. And also there is just a huge sense of, I don't know how I want to say it, validation when a veteran receives a service connection for a disability, to have the government say, we see you, we recognize you, we are acknowledging this, and you will be compensated for your disability that was caused by the service. So never too late to apply for that. There is something called a non-service connected pension, which is much less usually than the service connection amount. But for veterans who are 65 or older and served during a period of war and they're under a certain income, they can get a monthly non-service connected pension, which I think is about $1,300 a month. And then there's something called aid in attendance, which I get a lot of calls about. This is if a veteran is already getting a service-connected disability or a non-service-connected pension, if they are needing help with activities of daily living, if it's hard to get out, they're just needing more assistance, they may be eligible for aid in attendance or housebound status. And basically that would be extra money on top of what they're already getting to help pay for care. That can go towards privately paid in-home support. It can be put towards assisted living, help pay their bill for assisted living. This is money that goes straight to the veteran, and then they do what they need with it. This is like one of the very few benefits that survivor spouses are eligible for. So if there's a surviving spouse out there that their loved one, their veteran was service connected or getting a non-service connected pension, they may be eligible for this aid and attendance benefit. I get lots of calls about survivor benefits. The VA healthcare system can't do anything for surviving spouses. We can't do home care, nursing home placement, VA pay hospice, but this financial benefit may be available to them. Just a very quick overview of survivor financial benefits. If a veteran was service connected, their spouse may be eligible for this dependency and indemnity compensation, which is a monthly income of about $1,600 a month. Lots of criteria. The veteran has to have been died due to their service connection or in active duty, or they have to have been 100% service connected 10 years total at some point, or 5 years prior to death. So service connections can go up and down. So you may be 100% right now, but if then your cancer is cured or you have knee surgery and your knee's not bothering you as much, the amount can go down. And then if it's causing more problems, it can go back up. So that's why it's mentioned like that. You do have to be married for at least 12 months prior to the veteran passing to be eligible for the DIC benefit. And then there's a survivor pension, which is comparable to the non-service connected pension. So it's income-based for spouses of veterans who served during wartime who are under a certain income. They may be eligible for this one. I encourage all surviving spouses to apply for this one. The criteria, I'm going to be honest, it's confusing to me. So please encourage people to go to one of those benefits reps and apply for these things. We never want a veteran or their loved one to miss out on something they may be entitled to and have earned. There is a burial allowance benefit that some veterans are eligible for. It's a reimbursement. It can be provided for reimbursement for the expenses at the funeral home. I want to first, before I start, clarify, VA does not pay for funerals in general. A lot of veterans believe that veterans are going to pay for their funeral, going to pay for their burial. They tell their families that. That is a myth. Unfortunately, there are some national cemetery benefits, which I'll get to, but in general, veterans and families are responsible for the cost of their burial, and some may be eligible for this burial allowance. So I am not great at explaining this one either, but I know that there can be a burial allowance that goes towards like cremation or what happens at the funeral home. There's also a small allowance for a privately purchased plot. 2-year supply. There's also some reimbursements for headstones or markers. In order to be eligible for the burial allowance, you have to meet one of many criteria. I don't think you have to have either died because of your service connection, or you have to have passed at a VA facility or one of our contracted nursing homes. There are a lot of other ways to meet that eligibility, but it's tricky. So I'm happy to reach out to families. You can look at this on the website, but again, sending them to one of those trained benefits reps is the only way for them to verify what they're eligible for with the burial reimbursement. And it certainly, I think it goes up to $2,000, which certainly does not usually cover what the funeral home expenses will be. The VBA also issues a lot of really nice items to memorialize and honor veterans at end of life. Veterans families are entitled to a United States flag. There are VA headstones that can be requested, military funeral honors, which usually the funeral homes coordinate. There are these medallions. That's a picture in the middle that can be put on a private a headstone. All of these require separate applications because it's the VA. And there's presidential memorial certificates as well. And you can request as many of those as you want for family members. So just a lot of really nice ways to honor veterans. Even if you have a veteran who the family says, we've already paid, we already made arrangements, he's not going to a national cemetery, he's going to the private family cemetery, make sure that they know there are a lot of really nice ways they can still honor and recognize their veteran, and make sure they take advantage of those. There is a new benefit that came out this summer where I probably did this in the wrong order. The next slide, I'm going to talk about the National Cemetery Administration and burial in a national cemetery. If a veteran or family does not want burial in a national cemetery, they can choose to apply for one of these really nice branch-specific urns or memorial plaques. So if they're going to forego their eligibility to be buried in a national cemetery, they can apply for one of these urns. This is brand new. I think this one says Air Force on it. But these are really nice. It's a one-page application, and I can email out some information about those. All of these things can be applied for online. I just feel like most of our veterans and their loved ones struggle to apply and fill out the VA forms online. They're tedious. They're a lot, but they could do it online. Any questions before I go to NCA? Questions about the urns or memorial benefits?
Liz, we had a question about if we'll send the presentation out, and yeah, we will send out a YouTube link so you can share it with your clinical staff along with the slide.
Yes, and it'll be on our website too, just like the last few meetings. We've been posting our presentations on the website. Thank you. Okay, so the third branch of the VA is the National Cemetery Administration. Again, like everything, criteria and eligibility is confusing, but almost 100% of the time, if they're eligible for VA healthcare, they're going to be eligible for burial in a national cemetery. I know they have to be, they cannot be dishonorably discharged, and there's some other criteria, but it basically aligns with medical center criteria and is actually expanded to that. So veterans and their dependents, spouses and dependents, can be eligible for free burial in a national cemetery. If you go to the NCA.gov website, you can see a map of all the different national cemeteries around the country. But if they're eligible for the free burial, that includes everything that happens once they are on cemetery grounds. So again, VA doesn't pay for what happens at the funeral home, but if they're eligible for the NCA burial, it includes the gravesite, the headstone, perpetual care, the opening and closing. The NCA staff are wonderful and will coordinate the funeral, military funeral honors, and they have a nice service. It's beautiful. Here in Indianapolis, we have Crown Hill that has a section for veterans, but it is a columbarium. It is only for cremated remains only. I know Marion has full casket burial, but you can go on the website and see what all the cemeteries are and what types of burial they allow. Marty, do you have anything to add to that? If not, no problem. I will.
So I think we've got it all.
Okay. So tips for hospice agencies, just to kind of summarize everything I've gone over. Please make sure your veterans and families understand VA does not pay for funerals. They may be eligible for a small reimbursement. They may not. If they want to verify they're eligible for the National Cemetery Administration, there's a form. It's called pre-burial eligibility. You can Google it, or when we send this out, go to the link. You can always send your veterans and families to a benefits trained expert. We'll make sure you have the list of those people to verify what end of life benefits they're eligible for. Make sure that your veterans and their loved ones have a copy of their military discharge paperwork. For absolutely everything I've talked about today, they will need a copy of their military discharge record to apply for these things. It's usually called a DD-214, but I have found in some of our older veterans, it can have different names. So it's not always a DD-214. And there's a way to get that pretty quickly if you go to the website and make sure you highlight for emergency request for funeral or medical emergency. I have seen funeral homes help people do this, and they can get it within a week usually. If you don't put it's for funeral or medical emergency, you're talking 6 months probably. So if you're bringing a veteran onto hospice service and you've identified they're a veteran, please ask them about if they're enrolled in VA healthcare. And if not, get with us about that. And if they don't have a copy of their military discharge paperwork, make sure they go ahead and get a copy of that. They may say, I'm never going to need home care. I'm never going to be buried in a national cemetery. Go ahead and request a copy of the DD-214 because you never know and you don't want to have any barriers. The VA has a couple really nice guidebooks for families that I can send out, the electronic copies. There is the Planning Your Legacy guidebook, which has an overview of all of these benefits. And then there's also one that was just sent out here recently to the VAs in the last month or two. And it's all the same information, but it's directed specifically to the bereaved families. So when a veteran has passed away, this book highlights a little bit more about survivor benefits, a little bit less on things like education and things like that. So if you all are interested in hard copies of these, let me know. I could send a few to your office, but also you're welcome to print them out and give them to veterans. So just another recap. Please reach out to the VA if you have a veteran on service who may be needing VA pay for hospice, evaluation for a VA end-of-life nursing home contract, additional home care, respite, inpatient or nursing home respite. If you need help getting a veteran enrolled, if you think they'd benefit and they're agreeable to mental health services. If you have questions about end-of-life benefits, please reach out to us, me and Champaign here in Indy, or Marty. We can staff each case individually with you and figure out how to help. Please notify us when a veteran enrolls in hospice or when a veteran on hospice passes away. This is important for several reasons. When a veteran enrolls in hospice, we like to update their medical record. This does a couple things. It helps for VA statistics to track our veterans and know what's going on with them. We can also update their medical providers, make sure everyone's on the same page. It also prevents the veteran from getting any copays from the VA for the rest of their life. If they are labeled as being on hospice end of life in their chart, they will not get any copays for those home care hours, etc. And they don't have to, if we're setting up home care, we get to skip some steps. We don't have to do financial stuff and figure out their copay. A lot of veterans come here for primary care and are set up with hospice somewhere in the community. So please make sure we know about it. We appreciate that. And then you letting us know that they've passed away allows us to update their medical record, tell all their providers, and it also gives us the chance to send our own sympathy card to their family. As I mentioned, the veterans and their families identify with the VA. We don't want them to feel like we've forgotten them. And so we appreciate the opportunity to be able to close that loop. We know it's some extra work for you all. We also know that there's no way for you to know if a veteran is enrolled in VA healthcare for sure. So if you call us to let us know someone enrolled or passed away and they're not, enrolled with us, no big deal. We'd rather be contacted for all of them and than miss out on some. So for any of these things I've talked about today, if you're in the Indianapolis area, you can call our palliative care team. Here's the number, me and Champaign's contact information. And if you are in the Northern Indiana service area, Marty is going to be your contact person for sure. I will say we get a lot of questionable service area things. Like there seems to be a lot of you that cover veterans like in the Noblesville, Muncie kind of area on the north side of Indianapolis. And sometimes I can't tell where they go. So in those cases, you can just call me or Marty. And if it's the other one, we'll send you to the right person. Any questions for me right now? Or again, I will stay on the call at the end. Also, I am happy to give the presentation I gave today. I went really fast and I covered a lot of information. There is no way you all will ever remember all of that or even probably a good percentage of it. What we really want to stress is that if you have questions, if you have a veteran on service and you're thinking, Liz might have mentioned something about this or that, there might be something for this guy, just reach out to me and Champaign or Marty and we will figure it out together what your veteran may be entitled to, and we'll jump in wherever they're at, whether it's pre-enrollment or ready to be evaluated for a nursing home contract. We'll figure it out together. Just we want to bridge that gap and make sure you guys are comfortable reaching out to us. I also, like I said, went over this very quickly. I am happy to come to any and all hospice agencies virtually to give this presentation over an hour, however much time you all can give me. 30 minutes, 60 minutes, I will come and give this exact same presentation in more detail. I would love to connect with all the agencies and give this presentation, especially to your social workers, if not to your whole teams. I've been really happy to have given this presentation to about 5 agencies in the last few months, and I'm happy to come to any of you all. So please reach out and we're happy to go over this in more detail. A lot of you on the call are the We Honor Veterans coordinators and marketers. So if this information, if you want help getting this clearly articulated to all your direct care staff, let me know. Sorry, I'm talking so fast. I see that message. Yep, I can send some copies to Brighton on the bereavement resources. If anybody else wants hard copies of the bereavement resources, just shoot me an email. Okay, with that, I am going to